Hi, I'm Jennifer Hancock, and I'm going to be doing a talk on the cancer treatment Herceptin, which is also known as trastuzumab. Um, how it works, there is a gene known as the human epidermal growth factor receptor 2, or HER2, that has receptors on the cell's surface. As you can see, those are in the purple over here on the image. I'll circle a couple of them. And um, when HER2 is converted into a dimer, it allows for the autophosphorylation of the tyrosine residues within the cytoplasmic domain of the receptors and activates a variety of signal pathways, which leads to the cell proliferation and tumorigenesis. So what Herceptin does is it comes in and it binds to those protein receptors, and it doesn't allow them to do their job, which is going to be over here in this green colored fun shape. So what Herceptin actually is it's a targeted monoclonal antibody. So what those do is these monoclonal antibodies are a single type of antibody that target a specific protein or an antigen. So it targets these protein receptors that I was talking about. And they basically try and use the patient's own immune system to help fight whatever ails them. And in this case, it's cancer cells. And the most research that I've seen is the HER2 gene is expressed in breast cancer. And this is used for breast cancer that is HER2 positive. Some side effects of the therapy, the ones in bold are the more severe, so the heart damage and the congestive heart failure, which can either resolve after the therapy is over or it can be lifelong after the therapy is over. And some of the other more common ones are insomnia, weight loss, diarrhea, muscle, joint, back, and stomach pain, nausea and vomiting, and shortness of breath. Some of these can also be a side effect of chemo, and the Herceptin can either be taken on its own or with chemo, so there might be some adverse side effects with the addition of the chemo as well. A history of the Herceptin. In the year 1979, the HER2 gene was discovered by Robert Weinberg and found to be the trigger for cancer. 5 years later, after the discovery of the gene, Axel Ulrich, which can be seen here in this last panel, he identified the protein that the gene produced. Ulrich met up with Dennis J. Slaman, which is here in the middle. Yikes, that's an ugly arrow. And they worked together to prove that the overproduction of the HER2 gene led to cancers that are likely to reoccur and spread. And then here's Michael Shepard, this first one right here. All three of them worked together to help develop the drug Herceptin, which was finally approved by the FDA in 1998. Then they all three won the 2019 Lasker DeBakey Clinical Medical Research Award for the contributions in the development of the targeted monoclonal antibody Herceptin. And then here are my resources.